People are ready to work in the medical field. What is something you have had to explain to your patients that was super ridiculous and should be common knowledge? I'm a medical student and earlier this year I was taking a history from a patient during a bedside tutorial, where a senior doctor takes a group of us to see a patient together. I was speaking to this man about his symptoms, and used the word ong, to which he gave me a confused look. I said it again and he still didn't know what I was talking about. I ended up having to ask him if he had any pain in his dong while peeing, in front of my classmates and my tutor. Keep in mind that this was a guy in his 40s. Same thing happened, but I said urethra, so I wasn't surprised when I had to rephrase. I work in MRI. When we tell you to remove all piercings before your scan, we're serious. You can take out your belly button ring before you go inside the tube, or the machine will take it out for you. You'd probably remove it more gently than the machine, though. I don't work in a medical profession, but I do work in another place where terrible diseases run rampant and staff spend every waking moment fighting them off. A school. There was nothing more bizarre than explaining germ theory to a teacher. She honestly didn't believe that such a thing could exist. She sincerely believed that sicknesses were caused by negative energy and bad auras, and asserted that it was fundamentally impossible for something as small as a germ to harm something as large as a human body, if something that small could even be alive in the first place. She spouted off something about how a creature that small would be incapable of living for more than a few seconds, because energy can only get so small. A germ, she did finger quotes, could only hold enough energy to live for 1 or 2 seconds, at most. These are the people educating your kids. For everyone asking what she taught, grades 1-3, not exactly the kind of place I'd worry about a voodoo even needing to be brought up, but it shook my faith in her ability to be objective about other things, so I'm still uncertain. I mean, imagine if she was convincing an entire class of 3rd graders that they do not need to wash their hands. Caring for a woman in her 80s, had to explain to her that you don't pee out of your tea. There is, in fact, another hole. This reminds me of Orange is the New Black. Half an episode was devoted to female prisoners figuring out that they had a T and a urethra. I'm a veterinarian and I don't understand owners sometimes. I work at a clinic of a vet who's also a private animal nutritionist, so sometimes we do house calls for special cases. Client Bob's dog isn't eating well and he has no clue why. I go over and ask him to show me his feeding routine for his dog. He fills a bowl with kibble and the dog seems super excited to eat. I crap you not, he then goes over to the fridge, takes out the ketchup and drenches the kibble in ketchup. By this point my jaw is hanging open in shock and I can see that the dog has suddenly lost its enthusiasm for the meal. I ask Bob politely what he's doing and he tells me that his entire family has ketchup on every meal. I then spent the next 15 minutes explaining to him that his dog may not like ketchup on its food. Now the dog eats great. I'm a miracle worker. That just because you take medication that controls your ailments doesn't mean you don't have them anymore. I ask plenty of elderly people if they have any medical history and frequently get no as an answer, only to then look at their med list and find that they are on a dozen medications. Why do you take this blood pressure medication? Oh, because I used to have high blood pressure. Nope, not how it works. That yes, guys can be nurses too. I'm a guy, a nurse. No, I'm not a doctor. Yes, maybe I should have been a doctor instead, or maybe a woman. Paramedic here. Had to tell a 19-year-old that she needed to change her tampon more than once a month. She was in septic shock. BTW. I'm a guy. Even I know you gotta change that crap out. My sister isn't a doctor in Chicago. She once had to explain to a Mormon couple on their wedding night how to frick. The 19-year-old man had taken his 18-year-old bride into the ER, convinced his wife didn't have a T. She had to tell a mother of 4 that giving your children a heavy doses of vodka didn't not kill the bacteria in their bodies when they got colds. She also had to report that obviously, she had a very frightened 23-year-old girl come to the ER very afraid because she had found a growth in her crotch. It was her clit. When my sister was asking her how she had never noticed it before, the girl responded, "My mom told me if I touched my area that the devil would get me." The girl had lived for 23 years without ever touching or seeing her own T. I guess when she would wipe she would just blot the outside quickly or something. A female patient came in and told the doctor that she has been bleeding every month down there, thinking it had something to do with the birth of her daughter. Yeah, I can't emphasize enough the importance of physical education. Birth control does not go in the tea, unless it's a NuvaRing. Then stash that puppy up there like you're saving it for later. I get it. There are other forms of tea birth control. I'm a pharmacist. I'm well aware. But do you really think that the people I've counseled who used combined oral contraceptives, aka COCs, after the fact knew what those other forms were? I was talking about COCs. Don't put COCs, or POPs, in your hoo-ha. Till where unwanted puppies go. 2 things. 1 is take all the medication even if you feel better at day 3. And 2, you do not give your kid the leftover medication from part 1 when he has the same symptoms a week later. I was very unclear myself. I posted this on my break and as some have pointed out that what I said applies mostly to antibiotics, but please listen to your doctor if he says finish all 5 or WE days, just do it. Also, I don't have an addiction. I can quit whenever I want. My mom used help herself to my prescription stuff when I was a kid, whether it was to take it herself or redistribute it to my siblings if they had similar symptoms. As soon as I was old enough to handle my own medicine, I had to start hiding it, and we fought about my selfishness for the duration of the prescription. Wanting someone to make you a cup of tea is not a good reason to call an ambulance. For everyone asking, yes, I made the tea. After a half-hour blue light run, might as well. Left to my own devices, I wouldn't have made the tea. I was a student at the time and was told to do so by my mentor. In the UK, social care is part of our remit, so it kinda makes sense. I once had a pet owner whom I prescribed prednisolone tablets for ear infection. 1 week later I saw the dog and it was no better. I asked the owner if she had been giving the tablets. She said yes, and I asked how she gave the tablets. She promptly put the tablets in the ears of her dog. WTF. My wife is a postpartum nurse, and on more than one occasion she has had to explain that the baby does not come out of your butt unless there's a 4th degree perineal laceration. I work in a hospital. I was getting some history from this lady when she told me she was allergic to epinephrine, that is adrenaline, you know, the stuff in EpiPens that you'll give to people when they have an allergic reaction to stop an anaphylaxis reaction. So I asked her what reaction she had the last time she was given epinephrine, and she told me that it made her heart race and she couldn't settle down. Had to explain to her that that means it worked. I had a lady tell me once that EP put her into anaphylaxis. I just stared at her for like 30 seconds in disbelief before asking her what they gave her to treat it. I work at a pharmacy and we get crazy questions all the time. We had gotten a phone call from a seemingly distressed woman asking if we carried a larger size NuvaRing. My first thought was, holy crap, how big is your tea? But I realized that there is only one size of NuvaRing. So I told her to come up to our help window and we can try to figure out what the problem was. When she finally came up, I crap you not, this will most likely be one of the funniest things I have ever seen. She comes up, and she is honest to God wearing the NuvaRing as a freaking bracelet. Her actual thought process was if she wore the NuvaRing on her freaking wrist, she could have all the unprotected freaking she wanted and be just fine. The look on her face when we told her that it was a tea contraceptive, she turned ghost white and gave a meek thank you and hauled butt out of the pharmacy. I felt bad for her, but I could not help myself from laughing. TLDR. Read the directions on your prescription. My cousin-in-law is a physician. She had to explain to a then pregnant woman that her NuvaRing had failed because she was not in fact supposed to chew it up and swallow it. A pharmacy student told me this amusing knee slipper. A patient asked her if she could take 2 vitamin B6 soft gels because her doc prescribed her vitamin B12. At least she could do math. Taking your medication, which was prescribed as 3 times a day, meant you took it 3 times a day, not how bloody frequent you felt like it. When the doctor's nurses tell you that it is a very bad idea to leave AMA against medical advice, you should take their advice. Several years ago when I was a phlebot, drew blood, I went to the nursing station so I could grab someone to follow me into the room. The patient was given a clot-busting drug TPA. This stuff makes heparin look like child's play. and I would need to have a nurse hold pressure on the puncture site for at least 5-10 minutes to see if it had stopped bleeding in that time. The nurse told me stone-faced that they left AMA after that drug. Falling down could cause serious injury because you just don't clot at all. He was back in the OR a short while later. Another lady decided that even though she was in the ICU, that since she got 4 units of blood and felt much better, it'd be okay for her to go ahead and leave. Number. It's not okay. That is stupid. Yes, gonorrhea of the throat is a real thing. For clarification, she thought because he had gonorrhea, she could perform fellatio without catching anything. Please wipe your baby girl's front to back and do not smear poop on her tea. For clarification, I have wiped a plethora of baby girls after they had a bowel movement in their diaper, and while stool can get in every crevice, I always thought that wiping away from the tea and not smearing more stool into that area was a given. If I don't do that teaching now, when the child is a baby, it will not avoid all the UTIs and tea infections she'll start getting around 3 years old or younger. And a lot of times adults don't know the front to back thing, so part of my job is address this. And this isn't something I have to explain other than please don't do that, but I had a patient on Depo-Provera and had passed a large clot on the way to the office. Her mother put it in a Ziploc bag to show me and why a clot would be that big, and I was pretty horrified. For clarification, as with every situation, I handled it within my scope of practice and elevated it to the physician and pharmacy interns. But it turned out they had been a similar situation with one of her other daughters, and the mother had been asked to not bring the clot to the office during a nurse-only visit. She should call to be triaged by a nurse, and at that point would be told whether it should be brought into the office and how to do so, because depending on if this was a consistent occurrence and depending on what physician they saw, whether or not to bring it would differ. And certainly it should not be in a Ziploc bag wedged be in one's wallet and cell phone. That part should be common knowledge because 1. It's gross. 2. There is number 2. It's just gross. And lastly, if you are allowing your partner who has an active herpes outbreak use your ostomy stoma to pleasure himself, you will get herpes at the site of the stoma. For clarification, I don't remember if it was a colostomy or an ileostomy, but a stoma is regardless a portion of the intestine brought to the outside so feces can empty into a bag attached to the stoma site. Stomas are delicate and have to be cared for constantly, so that makes the whole penetration of it a bad idea to begin with. But the patient's reasoning was she didn't want to have vaginal intercourse and get herpes, so if he fricked her stoma, she'd be alright. As an aside, since some have asked, you can still shed virus and transmit herpes when it's not an active outbreak with blisters and sores, but transmission rates are much higher when in an outbreak. People who think their conditions don't count as medical problems because they're being treated. The number of people who say no to the question, "Do you have any medical problems at all?" who then list all the drugs they're on. However, my favorite isn't a genuine ignorance, but the way my friend deals with idiots by pretending it's simple ignorance. When taking a history from teenagers, young adults, and asking if they're active in their private lives. Yes. And are they using any contraception? No. He lights up and says delightedly, "Congratulations, you're trying for a baby. It's awesome." They're all like, no, I'm not. Yeah, you're freaking unprotected. That's how you try for a baby. Congratulations. No, look, I'm not trying for a baby. You are. That's how you have a baby. Congratulations. I've heard him do it a few times and it absolutely cracks me up. And it gets the message home. Number 17-year-old mother of one. That you just had a C-section does not mean you cannot get pregnant again. Use a condom or you know something. At our clinic everything is free. When I was 18 I had to go to the doctors because of a hemorrhoid. Whilst explaining treatments, the doctor said something along the lines of "you need softer stool." I was extremely confused until he finally told me that stool meant poop. I just restarted your heart on the ground in a liquor store. Yes, you do need to go to the hospital still. I know you were on your way to go fishing. Yes, you absolutely should skip that and come with me to the hospital. Yes, I'm serious. No, I didn't just cure you. Also, having to explain to someone at shooting H directly into his knee joint was probably not the most efficient means of taking the drug. 36-year-old 650 pounds man in with his second heart attack. He wasn't allowed to eat for 12 or so hours before his open heart surgery. He and his wife worried that he wouldn't get enough vitamins and starved to death. He died on the operating table, but not of starvation. Sad trombone. My mother is a registered dietitian. She had an obese patient who would bake an entire batch of cookies for lunch and eat all of them by herself every single day. Among other recommendations, my mother told her that she should try to eat just 2 cookies with her lunch instead. At a later date, the same patient came in for a follow-up. She was still gaining weight at an alarming rate, so my mom asked her again about the cookies. Her response: "I did what you said. I baked the batch into 2 cookies and eat them for lunch." She was literally making 2 massive, half-batch size cookies, considering them to be just 2 cookies. You need to brush your kids' teeth when they are young and cannot or will not brush their own teeth. If not, the teeth will rot and need extracted. 1. No, smoking cannot cure your diabetes. Please stop saying it did. You're in DKA right now and you haven't stopped smoking, right? Okay then, stop saying that. 2. You're not allergic to ibuprofen. You just told me you take Motrin every day. Stop. 3. You do not have a 10-inch mass in your stomach. At least not anymore. The CT scan would have showed it. No, our machine is not broken. Just stop. 4. Taking 50 Tylenol is not an accident. Stop. 5. You can't pop the veins in your dong from cooming too hard. Well, I guess you could because anything is possible, but I'm telling you, this did not happen to you. 6. You just told me you masturbate every day with the shower head on full blast. Don't you think that may be why your clitoris hurts? Try taking a day or 2 off. No, the pharmacy doesn't just have to stick a label on it. We have to call you back over because you said you've filled here before when you haven't. Call your insurance to get your info because you lost your card. Call the MD to figure out why he wrote for a strength that doesn't exist. Change the med because you have an allergy to it and didn't tell the MD. Get your insurance to pay for it. Make sure it won't kill you, then stick a label on it. Patience goes a long way in pharmacies. Go eat something for an hour and come back. Dentist here. I had a patient ask me what all the grayish white stuff was on her teeth after she brushed them. The answer was toothpaste. No, herpes isn't a death sentence. You got it from fricking someone who had it. You didn't frick. Did you have fellatio? Yes. Fellatio counts. No, it's not curable. No, it's not AIDS. No, look, you're not going to die from this. Yes, you have to tell your wife. Yes, you have to be honest. No, it's not AIDS. Conversation with a 30-something man. Living can be worse than dying for some. I work with hospice care and initiate a fair number of end-of-life discussions, and some families just don't understand what their loved one is going through. A nurse I used to know traveled to the Middle East to work at a small village for 4 months. She had dealt with a couple who had been trying to get pregnant for 3 years. Turns out he was fricking her in the butt the entire time. They both thought the tea was only for peeing. I had to explain to a patient that his HIV diagnosis didn't mean he had AIDS. It was actually really touching to explain he didn't have a death sentence over his head. Never saw that guy for again. Always think about him. My friend's mom is a nurse who counsels people on getting pregnant. She once had a couple come to her and say they were trying too hard for a few years but nothing was working. Tests are run on both and they're medically able to make a baby. They start to discuss IVF and the word T comes up. The couple is visibly dumbfounded. Turns out these people have been trying to conceive by the man getting an erection and just resting his dong in the woman's belly button until the erection goes away. Friend's mom had to explain the mechanics of fricking to 2 grown 20-somethings. 3 months later, pregnant. Note, this was in the early 90s, so the internet wasn't what it is today. The people came from very conservative Christian backgrounds and had never taken a physical ed class. See, abstinence does work. I'm a sonographer. Whilst performing a 20-week morphology scan, I had to reassure a hysteric mother that it was in fact a normal and good thing that baby had 2 kidneys rather than 1. And here I thought basic anatomy was common knowledge. That their urinary bladder is where pee is, and that when I say I need it full, please don't pee before the examination. I'm a firefighter paramedic and we ran a call on a man whose wife called because she had seen a bug crawl inside her husband's ear. He's complaining of burning in his right ear even though his wife insists the bug crawled in his left ear. Come to find out she had sprayed insecticide in his right ear thinking it would flush the bug out of the other ear. I had to explain to a full-grown adult that our ear canals are separated by a brain. I worked in a clinic on Kandahar airfield in Afghanistan. Almost everyone works out at one of two gyms and they have bleach cavi wipes everywhere to clean the equipment before and after use. Some people are lazy and didn't wipe the seats before they used them to get to the equipment first, and of course MRSA and other infections were rampant. So one day there was this guy that came in saying how he had a blister just below his gluteal fold, bottom of the butt cheek for those curious. He stated how he was going to the gym for weight loss and was having some great success but had some spotty to me meant lacking gym hygiene. The blister could be described as dewdrops on rose petal appearance with no signs of punctures. Yup, herpes. People don't understand that cleaning gym equipment is really important against spreading disease, especially in austere environments. Also, what constitutes diarrhea? Just one loose stool means you ate too much fiber and don't need meds to stop it. Any STDs? Number. Any medications? I take Combatit. And what do you take that for? It's for my HIV infection. This isn't the most ridiculous thing, more just ignorant, but it drives me crazy when people list allergies for things that they don't have an allergy to. I'm allergic to codeine. Okay, what happens when you take codeine? It makes me nauseous and lightheaded. It just wipes me out. Side effects equals allergies. Embarrassed to admit this, but when I was pregnant I was that patient. I went down a really bumpy gravel road and was worried that I gave my baby shaken syndrome. Also, after I successfully pushed her out during childbirth I was dumbfounded when the doctor told me to keep pushing. I was so confused. I wasn't pregnant with twins. Apparently it's common knowledge that you have to push the placenta out. I just thought it fell out. Did not know it needs to be pushed. Had to explain to a mom that it was definitely not a good idea to pour shots of alcohol down her 16-year-old's nose to get her to stop having a panic attack. Dad owns a hospital that does bariatrics, weight loss surgery. So, a morbidly obese lady had her stomach stapled to reduce the size of the stomach. This should lower the maximum you can ingest at a time, thus causing you to lose weight. 1 hour after surgery, the patient's boyfriend sneaks in potato chips and Häagen-Dazs ice cream. The patient crushes up the chips and melts the ice cream and gulps it all down in excessive amounts. This causes her stomach to explode about 2 hours after surgery. She put the blame on the unaware nurse and thought that she was following a slow, liquid diet. L&D nurse midwife here. People are really ignorant when it comes to reproduction and how their bodies work and whatnot. Me. Putting the stretchy belt over mom's belly that holds on the fetal monitor. Dad, but how will the baby breathe if it's over my wife's belly button? What? Me. Putting in the Foley catheter, drains urine when mom has an epidural. Mom, if you're putting that in my hole then won't it block the baby coming out? You have 3 holes. Pee hole is separate from baby coming out hole. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.